Before all of this started, I was just a normal college student. Slowly I started getting symptoms, headaches, numbness and tingling in my legs. My brain's a little too big for my skull, so it compresses the spinal cord.
Medical school, just for an average person, is the most difficult thing you're going to do probably in your life. To do this with neurologic complications, especially a stroke, I can't imagine.
But for me, I didn't see it as a barrier at all. I just kept persevering. I had brain surgery in colleges. I continued having brain surgery during medical school. I had a stroke that initially left me unable to function from the neck down. I had to learn how to sit up. I had to learn how to walk again. I had to learn how to brush my teeth again. Just things that we don't think about. Now that I finished my third year, I've been able to connect with patients on a whole different level. I know what it's like to have a feeding tube. I know what it's like to have a port. Some things that maybe doctors miss, I get because I was a patient. So I've always wanted to be a doctor since I was a little girl. Before all of this started, I was just a normal college student. I started getting headaches, I started getting numbness and tingling in my legs, and it got to a point where I would stand up and I would fall. I was starting to kind of black out, and we knew something was wrong. And it was then that they found that I had Chiari malformation. So when I got my diagnosis, I was sent to a neurosurgeon. He told me that I needed brain surgery as soon as possible. If not, I was going to be paralyzed from the neck down. And so within a week, I was undergoing my first brain surgery. Chiari malformation is where my brain's a little too big for my skull, so a portion of it comes out the bottom of the skull and it compresses the spinal cord, and then that can lead to paralysis. I thought I'd have one surgery. I knew my life would be a little different, but I thought I would have this surgery, go on to med school, and that would kind of be the end of my story, but it's been quite the opposite of that. So since I was first diagnosed in 2011, I've had 6 major brain surgeries. I think my lowest point was after my stroke, February 6th of 2017. At the time, my brainstem had actually become tethered to the back of my dura, and your brainstem controls a lot of your bodily functions. And so the surgeon told us ahead of time that we were probably going to encounter many complications, and unfortunately it did happen, and I had a stroke that initially left me unable to function from the neck down. I thought maybe it was a sign that I shouldn't go into medicine. People around me were very diligently telling me that I needed to leave medicine.
There's been a couple of people, doctors, that have mentioned to her that she can't go on, or, you know, because of her condition or her medical issues, but she's proved them wrong.
I looked at the things that I could do, and I said I still have something to offer.
I think if you take medical school, just for an average person, it is the most difficult thing you're going to do probably in your life. To do this with neurologic complications, especially a stroke, I can't imagine.
I had to relearn how to do absolutely everything. My mom still had to shower me, dress me. She was the one who would type my essays. I would tell her what to type and she would type them for me. She would drive me to wherever I needed to go. She would put my earphones in my ears for me so I could listen. So that's how I continued medical school when I couldn't actually do the things that I needed to do. It was incredibly hard. So TIER is amazing. They are responsible for my recovery. I always say if I didn't go to TIER, I wouldn't have the function I do now. They have equipment that other places don't have. I got to use a Rex exoskeleton. And it's basically like an exoskeleton that I get to go into, and that kind of taught me how to learn how to walk again. I think my experience has been a blessing in disguise, and I wouldn't change it for anything because I've been able to connect with patients on a whole different level. I know what it's like to have a feeding tube. I know what it's like to have a port. Some things that maybe doctors miss, I get because I was a patient. I recently got my feeding tube removed. So at one point I lost all function in swallowing. And so I needed a feeding tube so that way I could get my nutrition. It basically kept me alive for the past 3 years. So my graduation date is set for May 15th, 2020, so in about a year. And I plan to go into physical medicine and rehabilitation.
I'm just so excited. I just wait for that day, you know. I know it's going to be so special. She makes me proud, more proud each and every day.
Extremely proud. I think as proud as a father could be. I just love being able to be there for her, and she's there for me too.
You know, we hear about walks for different causes, and I had found a walk called Conquer Chiari, and I found there was not one in Houston. So I brought it to Houston. I've done it for 4 years in a row. I'm going to be a co-organizer again this year, and we've raised about $55,000 for research. And I'm also an ambassador for Fight Like a Warrior. It's a kind of an organization that links young adults together, especially ones that are dependent on like feeding tubes, ports, things of those natures, just to know that they're not alone and that
she just keeps going. She never lets go of her dream.